if your symptoms are relatively mild. Every citizen has a role to play, and I'm asking you to do that. You know, Louisianans have always been at our very best. Challenges out there. This is one of those challenges. It is time to be good neighbors. It is time to think of our brothers and sisters, especially those in those categories who are most vulnerable, the elderly, and those with underlying health conditions. If you have any questions regarding the COVID-19 virus, we encourage everyone to call 211 for more information. Again, that's 211 for more information on the coronavirus. Briefing will likely be Monday. If the circumstances warrant and we have updates to share between now and then, we will certainly do so. And at this time, I will take questions. Yes, sir.
Our temperature was checked before we came into the building. Do you encourage other places of people to do that?
And on the coronavirus. The next scheduled press briefing will likely be Monday. Obviously, if the circumstances warrant and we have updates to share between now and then, we will certainly do so. And at this time, I will take questions. Yes, sir.
Our temperature was checked before we came into the building. Do you encourage other places of people to do that?
Yes, I do. And so, you know, we have essential leaders coming in from around the state, state and local, as you can see on the stage with me, into this building. And one of the things that we want to do is make sure that people coming in here are not potentially spreading the coronavirus or potentially other illnesses as well. And so we are temperature checking individuals. And if you have a fever that's unaccompanied by a cough or other flu-like symptoms, then you don't need to do anything other than go home. And fever is anything 100.4 or more for this purpose. If, however, you have fever plus cough, other flu-like symptoms, then you need to take a flu test. If you take the flu test under that circumstance and you are negative, then you need to take a COVID-19 coronavirus test. And so that's what we've implemented here. I think you're going to see something similar at the state capitol, and we have some legislators here where they're going to be doing that as well. Yes, sir.
Governor, can you tell us how many cases are at the Lambeth House in New Orleans so far?
9.
Still 9?
9. Well, with a caveat, I don't know that we have all of the information with the batch that just came in, but subject to an update, we have 9 cases at the Lambeth House.
Were any of those cases in East Baton Rouge Parish or surrounding?
Not to my knowledge, but there's not perfect information on a few of those positive cases as related to parish of residency. We will be updating that just as soon as we possibly can. Yes, sir.
Your proclamation sort of left it up to school districts if they're going to provide free lunches for students still, if they're able to.
Yeah.
Is there anything the state is doing to help local school districts who might not have the ability to do that, and also to provide distance learning, online learning?
Well, all the school districts have the ability to do it because they have lunchrooms. The waivers from the USDA have been granted. And, you know, for example, I will tell you what I know they're doing in Caddo Parish. They have identified a number of schools, and I think it's 12, I'm not certain, where during meal times you're going to be able to drive through with the students and pick up meals to go. So there will be bag breakfast and lunch and so forth. I guess it's technically true that my proclamation left it up to them, but I think the word is that they shall do it to the extent that they can. And I think that making this nutrition available to our kids is extremely important. And so this is something that the Department of Education, under the leadership of Beth Ciano right now, is working with all the districts. And it is my expectation, quite frankly, that this will be provided in every school district. I can't tell you that will be the reality come Monday, but that's what we're anticipating. Yes, sir.
The president was talking about drive-through testing sites.
Yeah.
Are you guys considering that at all?
Yes, in fact, we are in communication with FEMA and the Health and Human Services in Washington, D.C. It's at the early stages, but we have been offered an opportunity to create at least one of those drive-through test sites in the New Orleans area. I don't have any information right now as to exactly what that's going to look like when it will be set up. But we are working with them. We're certainly not going to turn down an opportunity like that. As soon as we have more information, we will put that out and make it public.
You talk about test kits. Do you have enough? Is more coming in?
Well, I'm going to let Dr. Bu, who is here. He is in charge of our testing. He's got that information available right now, and I will tell you that for the persons under investigation that we are testing, the testing capacity that we have is sufficient, and we also have commercial testing that is coming online. We are conducting testing at the public lab, the state public lab here in Baton Rouge 3 times a day, and we're providing the courier services to move samples in order to keep up with that pace of testing. And we're going to see over time more commercial testing come online. We know, for example, that we have healthcare providers that are using LabCorp and other private labs in order to test for the coronavirus as well. And we're going to make sure that as the information comes in from those private testing companies, that it is merged with what we're doing here as a state, so that when we give you information and when you go to the website of LDH, it's going to have all of that in the running totals. So that's what we're working on now, but I'll ask Dr. Bu to come up and respond specifically to your question.
Thank you, Governor. I agree with everything the Governor just said, and I think that the point to emphasize is to meet the capacity that we want to at the state level to get those tests to everybody who has symptoms and is flu negative. As the Governor said earlier, we really do need to partner with the commercial sector. You heard that yesterday from the President as well. And so we're looking to see those capacities increase. Currently, we are in a good position at the state lab. We'll note that, it's not just the test kits. There's all sorts of things that go into testing, including the ways that we take samples. And we're trying to look upstream at all of those things, making sure that there's a path. But we also understand the entire nation is doing that as well. So we're going to be keeping an eye on that.
Could you tell us how many total people were tested?
So I believe currently we are at 178 persons under investigation. And again, the best source of that data, in case I'm wrong in what I just told you, is going to be on our LDH website, and that's updated regularly.
Now, there is some surveillance testing as well, and I don't know that your numbers include any private labs, or do they?
Yeah, it's worth noting our numbers are going to be reporting what's in our state lab, but as the Governor noted, we did amend the sanitary code a week ago such that all labs that are performed for COVID-19 in the state are reportable to us. So far we know of 7 of those tests.
Governor, there's some overflow isolation areas being set up in state parks. Can you talk about why those are needed right now, what's happening, how we decide who goes to these places?
Well, we need to make sure we have the capacity to take care of individuals who may test positive for coronavirus, but they're not so sick that they need to be hospitalized, but they may be homeless. And so we're just identifying areas where we could put these individuals so that their needs can be met in the safest possible manner, and that's what we're looking at there. It's a contingency for when we have individuals who are positive, don't need to be hospitalized, but don't have a place to go, and we need to be able to put them somewhere and have wraparound services, and that's what we're looking for at those locations.
Governor, shut down K-12 schools and addressed that so far. Is there any indication of how much further we could go, what the next step would look like, and what else we're discussing now?
Yeah, well, there's nothing else under discussion right now. There are not a whole lot of other things that can be done. There are a couple, and they get to be more drastic. You only have to look at New York, for example, that actually established a containment zone and is limiting movement in and out of that zone as a mitigation measure. So the additional measures are very restrictive, and we don't have a recommendation from CDC and to do those things yet, because the facts on the ground don't yet warrant them. But there are a couple of other things that can be done. Any other questions?
Governor, do you think the legislative session should be suspended?
We're working with the Speaker and the President and legislators on that, and they're taking some precautions, and I know right now the plan is to continue with the session to do its work. There are also some contingency planning that's in its early stages, and I appreciate their willingness to engage in joint efforts to develop those contingencies and make sure that if it does become necessary to suspend or discontinue the session, that the essential work is necessary. Obviously, come July 1st, we start a new fiscal year, and we need to have a budget in place, for example. So there are some legislative instruments that are must-pass, and we're identifying those, and we're coming up with contingency plans right now. But the plan, as of right now, is to continue with the session, and if the situation warrants that approach be modified, then we will let you know at that time. And again, obviously, we're working with the Speaker and with the President on that.
Would it take like cases in Baton Rouge or out of state capitals or anything like that, or any idea what?
When we have facts that change, that warrant a change in that approach, we will let you know. Okay, I want to thank all of you for coming out today. And again, I'm going to ask the people of Louisiana, as I always do with any disaster, do everything you can to comply with the guidance that you're being given by me and by other authorities. And also, as I mentioned earlier in the different contexts, I like most of Louisiana, believe in the power of prayer. And so I would ask that people pray for our country and for our state and for our people. God bless you and thank you.
Governor John Bel Edwards just wrapping up a press conference there addressing the very latest on COVID-19. The big takeaway out of this press conference has to be the number of cases. It has gone from 36, what we reported this morning, now to 67. Governor Edwards is saying that is high given the population size of Louisiana, and that is one of his biggest concerns right now. Another takeaway here is that he is limiting, again, this is something he said earlier, he's limiting crowd sizes of more than 250 people. And again, older residents are really the ones that are most at risk here. Older residents or anyone with any underlying health issues. The CDC, though, does say that Governor Edwards and the steps that they are taking here in Louisiana have worked to minimize the spread of COVID-19. However, they are looking at a number of different options from the federal government to look for funding and options to help businesses that might be impacted by this. That might make some SBA loans available for businesses. There's a number of different things like that. Of course, Governor Edwards saying that every person in Louisiana has a role to play to minimize the spread, even folks just washing their hands, doing social distancing, and all the practices that we've been telling you. The other case has to do with the fact that they are exploring the possibility of doing drive-through tests. That is a big thing that's still not online just yet, but Governor Edwards did reiterate that he is looking at options to have people be able to be tested when they are just simply driving through with their car. So this is a situation that we are closely monitoring. I do want to give you our website, wwltv.com. Make sure you stay close to that for the very latest information, but we will get you back to regular scheduled programming.
This has been breaking news from Channel 4's Eyewitness News. For the latest updates, go to wwltv.com, the Channel 4 app, or our social media pages.